Hello, I'm Tibby Guzman, Executive Director and CEO of the ARC Westchester. It is that time of year again for open enrollment of our health and other insurance benefits. We know that this has been a very tough year for our employees due to COVID-19. We keep in mind the financial challenges and medical concerns you may have during this time. In doing so, we took a special time in planning and presenting you with what we hope is a balanced and easy transition to your 2021 benefits. You'll be happy to know that we have taken every step to ensure that any increase will be as minimal as possible. Now I'd like to show you some key points in our benefit plan. The medical insurance key points are, first of all, Cigna will remain our medical insurance carrier. That's very important to all of us. Additionally, biweekly employee contribution will remain the same. Therefore, there's no change in your biweekly payroll checks. All medical copays, annual deductibles, and coinsurance will also be the same. Now I want to share with you the two challenges we face for our next year's medical insurance renewal. Our first challenge is related to our premium fee. Our premium fee is based on our loss ratio. Loss ratio is the amount we pay in premiums versus the amount Cigna pays in claims. As you can see in the graph, our ratio was over 100%, which means last year Cigna was paying out more in claims than they were collecting in premium. Our loss ratio for the last 12 months was 106.2%. Due to the loss ratio, our initial renewal was 17.6% increase, which is close to $1 million. Our second challenge is related to our reduced revenue. Given the ARC Westchester funding cuts this year is unaffordable to sustain because OPWD and the Department of Education are issuing major cuts in our reimbursement rates. Now I'd like to talk about our solutions. However, our highly skilled consulting firm, AJ Gallagher, and our CFO and Director of Human Resources redesign our benefits to ensure our employee benefit needs are taken into account, along with the ever complex and changing healthcare market. With Gallagher's recommendation, and despite the increase in healthcare costs and the current uncertain economic times, we are pleased to continue to offer a comprehensive medical insurance coverage to all our staff. The ARC Westchester also did its due diligence, and after a survey of similar organizations of our size in Westchester, we are proud to say the ARC Westchester health benefits remain competitive. For our dental services, these are some key points. Our contribution for dental insurance will remain the same for the PPO and lower for the DMO. We are, however, changing our carrier from Empire Blue Cross to Cigna Dental Plan. For those of you who have been employed with us for a long time, you may recall that Cigna was once our carrier for our dental plan. Just like Empire, we will continue to have two choices of plans with Cigna. Our consultants will explain this plan in detail. For everyone's health and safety, we are having these open enrollment meetings virtually. To further assist our employees, we will be recording this meeting so that it can be accessed anytime during the open enrollment period. Cigna has opened a dedicated pre-enrollment telephone line for our employees to call with any questions or concerns for them specifically. We will also have two dedicated Q&A sessions which will be held December 7th and December 8th, right before enrollment deadline in case of any last-minute questions. For this year, we will have a passive enrollment for both plans. You will only need to go to ADP if you are making any changes. Thank you for your continued dedication to our mission, especially in these difficult times. We know benefits are very important to us all, and we will continue to strive hard to provide you with the most comprehensive benefits possible. Now I would like to introduce our next speakers. To explain our plans in more detail, we have Jessica Arneman from our HR department, Matt Kingsley from our consultants AJ Gallagher, and Susan Ferrara from Cigna.
Thank you, Tibby. Hello, everyone. We would like to welcome all of the ARC Westchester staff to open enrollment. We are pleased to offer this comprehensive benefit package. Just some housekeeping rules. Everyone on this call is currently muted. All questions you have can be entered in the chat at any time on the lower right-hand side of your screen. We will answer all questions at the end of this video. If you're watching a pre-recording of this meeting, please attend our Q&A sessions or call Cigna's pre-enrollment line with any questions. Now I'll pass this to Matt Kinsley, our benefits broker, to explain more in depth our 2021 medical, vision, and dental plans.
Thank you, Jessica. On the screen now is the agenda for today. I will discuss what open enrollment is. We will review all the medical benefits, any carrier or plan changes, and then we will review what you need to do as an employee to make any changes for the 1/1/2021 plan year. ARC Westchester offers comprehensive benefit programs designed to support your health, wellness, income protection, and career development for the staff to support our mission. Open enrollment is the time of year where you're able to make any changes regarding plans movement from one medical plan to another, from one dental plan to another, as well as remove or add any dependents. Any change you make now will be locked in for 1/1/2021 through 12/31/2021, unless you experience another qualifying life event. A few important benefit terms you may need. A copay is the fixed dollar amount you pay for in-network, office, urgent care, or ER visits. Your deductible, the amount you pay each calendar year before the plan pays benefits for hospital inpatient and outpatient services only. Your coinsurance is the percentage the plan pays for services after the deductible is met. Out-of-pocket maximum. This is the most you will spend in a calendar year before the plan covers 100%. Your deductible, coinsurance, and copays all count towards your out-of-pocket maximum. A few updates for the 2021 plan year for your Cigna medical plan. You will continue to stay with Cigna on their large nationwide network with two plans. The contributions will remain the same for both the low and the high medical plans. Plan changes are as follows. The increase to your maximum out-of-pocket on the low plan for an individual, it's going from $4,500 maximum to $6,000. It's also going from $9,000 for a family to $12,000. On the high plan, you're going from $2,500 for an individual to $4,000 and $5,000 to $8,000 for the family. There's also an increase in your prescription drug copays. This is for both plans. For a 30-day retail generic prescription, it's going up from $5 to $10. Your formulary is going from $25 to $35, and non-formulary is going from $40 to $50. Your mail order is 2 times this. It's 90-day supply, and it's 2 times your current copays. So this is going up from $10 to $20. Your formulary is going from $50 to $70, and your non-formulary is going $80 to $100. On the screen are your 2 medical plans, and in red, you can see the changes that are effective for the 1/1/2021 plan year. Both plans, as you can see, do not have out-of-network benefits. On the low plan, your annual deductible is $1,500 for a single, $3,000 for a family. The high plan, it's $500 for a single, $1,000 for a family. Both plans have a 70% coinsurance, which means what you are billed, you will pay 30% and Cigna will cover the other 70% of what's billed. You can see in red the changes to the out-of-pocket maximums we just mentioned, and you can see that the copays for primary care visits, specialist visits, urgent care, and emergency room match between both the low and the high plan. I will now pass it off to Susan Ferrer from Cigna to walk through some Cigna benefits.
Thank you, Matt. Good afternoon, everyone. My name is Susan Ferrara, and I am ARC Westchester's dedicated engagement consultant. My main focus is overall employee wellness and education, and presenting the Cigna programs and resources for you today on a virtual platform is just one way we are making sure that you are staying as informed as possible during this challenging time. MyCigna.com is essentially your golden ticket into your personalized experience with Cigna. This is the site you can access from your desktop computer or your mobile device at any time. The site is extremely user-friendly, and actually the mobile app just got a great facelift, making it even easier to navigate than before. This slide highlights some of the features of the MyCigna.com site that are likely most important to you. But I also want to point out that you can access your ID card at any time on MyCigna.com. So if you've forgotten to put your new ID card in your wallet, or if you have a dependent who's at the doctor or pharmacy and forgot their card, you can send them a picture easily if they have not registered at MyCigna.com. Additionally, using the cost comparison tools for providers, facilities, and drug prices is critical for saving money and using your plan effectively. It is definitely worth taking a few minutes to register for MyCigna.com, play around on the site, and perhaps learn about a new Cigna resource you didn't even realize you had. Of course, if you ever have a question about the site or how to access something, you can always call the number on the back of your ID card, and our representatives will be happy to walk you through it. Next slide, please. Currently, Cigna Virtual Care offers two vendors, MDLive and Amwell. One change coming for 2021 is that your Cigna Virtual Care provider will be MDLive. If you are currently registered with Amwell for virtual care, you will need to re-register for MDLive. One of the reasons we are shifting Cigna Virtual Care to MDLive solely is because of the multiple enhancements available using MDLive for Cigna. These include not only behavioral services, which we will talk about in the next few slides, but also now you have the ability to have your annual physical virtually using MDLive. This is a great option if you currently do not have a relationship with a primary physician, or you're just not comfortable going to your doctor's office at the moment. I have used this service at least 6 times for my own family, whether it's a Sunday morning and my son's pediatrician isn't available, or we've been on vacation and one of us gets a sinus infection. It's an invaluable, convenient, and cost-effective way to treat minor illnesses and issues. Next. It is very easy to access the MDLive site directly through your MyCigna.com site and only requires a one-time registration with your information, your health history, and any medications you are taking. You can access virtual care 24 hours a day, 7 days a week, 365 days a year. It will be very important for you to access MDLive through your MyCigna.com account so that MDLive knows that you are a Cigna customer and will link your medical and behavioral benefits to the services you are receiving. Remember that you will also add your pharmacy information into your registration. So in case a provider needs to prescribe a medication for you, they can easily send that prescription electronically for you. Next. We are constantly increasing our behavioral network to meet the needs of our customers, and in the environment we are currently living in, access to care, whether it's virtual or in an office setting, is critical. On January 1st of this year, Cigna increased our behavioral network by 77%, by adding a behavioral component to Cigna Virtual Care, allowing our customers to access behavioral care virtually through MD Live, which I mentioned on the previous slide. This platform provides our customers with the ability to seek care from the comfort of their own home, their office, their car, wherever they are that's convenient. This slide highlights some of the behavioral and mental health conditions that can be treated by the behavioral providers at MD Live. Our Cigna behavioral providers are also increasingly offering virtual options through their own platforms. Also important to note is when you search for a behavioral provider on mycigna.com, it will be noted in the provider's profile if they offer virtual counseling currently. As our current climate with the pandemic is so fluid right now, you can always ask your Cigna provider as well if they will accommodate a virtual session, even if it is not indicated on mycigna.com. Next. Cigna's Vision Plan affords you access to one of the largest specialty networks of quality eye care. While you do have the option to use an out-of-network provider for vision, staying in the Cigna Vision Network will provide you the most benefits. Also, there's no claim paperwork when you stay in network, as the provider will submit everything for you. As a Cigna customer, you will also have access to Cigna Healthy Rewards, which may provide even more discounts if your provider participates in the program. The Healthy Rewards program is separate from your medical and vision plans and provides additional discounts you and your family might find useful. All information on the Healthy Rewards program is accessible on mycigna.com under the Wellness tile. Next. These are your employee contributions for the 2021 plan year. And as Matt mentioned, there are no changes to your contributions, so these numbers should look very familiar. Please remember, these amounts are assuming you've completed your wellness program requirements for the 2021 plan year. Next. In 2021, your Cigna coverage is moving to Cigna. Your dental coverage is moving to Cigna. You will still be afforded 2 plan options, but you will only need to access one site for both your medical and your dental providers and claim information. When you log into mycigna.com, you will now see your dental plan as well as your dental ID cards as well. One of your options for 2021 will be the Cigna DHMO plan. The DHMO plan allows you to maximize your savings as you will pay less for the DHMO plan than you will for the DPPO plan, which we'll go over in a few slides. Like your current DMO plan, there are no deductibles with the DHMO. Remember, deductibles are amounts that individuals have to pay before their plan begins to pay a portion of their dental care costs. With the DHMO, there is no upfront expense before your coverage begins. Also, like your current plan, there are no annual dollar maximums with the DHMO. So while you may be used to having only a set amount of funds available to you for dental services on the PPO plan, the DHMO doesn't have any annual dollar maximums. And lastly, your out-of-pocket costs for covered procedures are listed on a patient charge schedule, regardless of which Cigna DHMO network dentist you visit. This will make it easier for you to budget for your dental expenses. Next. As I mentioned a few slides ago, all of the care accessed through the DHMO is based on a fee schedule. This slide reflects some of the covered services included in your coverage. And as always, it's important to note that the DHMO offers orthodontic care for both children and adults, unlike the DPPO. Next. With the Cigna DPPO, you have the option of staying within the Cigna network or using an out-of-network dentist and do not require a referral to ever see a specialist. The DPPO plan is different than the DHMO plan in that it has a deductible, a co-insurance amount for certain services, and has a calendar year maximum. The calendar year maximum is what I'd like to think of as the bucket of funds available for your dental services. Obviously, the more funds in the bucket, the less money that will be coming out of your pocket, especially if you need some major dental work within the year. But once you meet the maximum, the plan no longer will pay any portion of the costs within that plan year. If you recall, the DHMO plan we talked about on the prior slide, there are no annual maximums on that plan. So if you are someone who is typically requiring a lot of dental work or planning on having a lot of dental work, you will want to keep this in mind when picking which plan will be best for you and your family. The annual maximum on the DPPO plan is $2,000 for both in and out-of-network dental providers. But if you stay in-network, that amount will last you longer as the Cigna dentist will be reimbursed at the lower Cigna contracted rate than the out-of-network dentist. Next. The DHMO plan provides in-network coverage only. This plan is a lower cost option, so it would be worth you checking to see if your provider is in the DHMO network already. If you do not have a relationship currently with a dentist or are flexible and willing to change dentists, this is a great option for you to seek in-network care. All of your dental care is coordinated by a primary dentist that you will select, but you do have the flexibility to change the dentist as necessary or desired. When you search for your dentist on mycigna.com or Cigna.com, you will want to pick the Dental Care Access Plus network. This is our largest DHMO network available. Next. I can't stress enough that your dental health is directly related to your medical health. Some of you may have put off your preventive dental cleaning over the last 9 months, but it is important to make those appointments now and to keep them to avoid larger issues down the line. For those individuals that have certain medical conditions, your providers may have informed you that you would benefit from additional dental care outside of what your plan typically pays. For those individuals, we have the Oral Health Integration Program that allows for additional periodontal treatment and maintenance at no additional charge in an effort to manage not only your dental care, but your medical care. The Oral Health Integration Program is available to all Cigna dental customers, regardless of their medical carrier. Customers must have at least one of the specific medical conditions to qualify for reimbursement, and the details and enrollment forms can be located on mycigna.com. If you have any additional questions, please reach out to Cigna directly and we'll be happy to explain the program in more detail if it applies to you. Next. This slide shows a snapshot of the conditions that are covered under the Oral Health Integration Program. Again, if you think this pertains to you, regardless of whether or not you are covered under Cigna for the medical plan, please consider looking into this program to assist with your care. Next. There is an abundance of dental resources on mycigna.com and Cigna.com for you to refer to as well. In addition to the health assessment located on mycigna.com, you can also take an oral health assessment that will give you a snapshot of your dental health based on your answers. This is a great tool to use, and you can even print your results and share them with your dental provider. Next. Hopefully, some of you have already taken advantage of the cost comparison tools available to you on the medical side, but you also have the same cost comparison tools for your dental care as well. Depending upon which plan you choose, you will see the approximate costs for providers and procedures within your geographical area. I also want to mention a tool called the Brighter Match. At Cigna, we work hard to help you find the care that is right for you. The Brighter Match service highlights network providers who meet certain quality and cost efficiency measures and who have the highest patient satisfaction from verified reviews. So you'll be able to see reviews online from actual Cigna customers who have been to see that provider. And it is important to note that a review is not posted to that provider's profile unless we have verified it with a claim. Next. This grid provides you with a high-level overview of your dental benefits. Just like your medical plans, all preventive care is covered at 100% and not subject to your deductible. Depending upon your dental care needs and how you use your plan will determine which plan is best for you. If you or your child will need braces next year, opting for the DHMO would be your best option, as you do not have orthodontia coverage available on the DPPO. If you're not sure which plan to pick, please feel free to reach out to Cigna's pre-enrollment guide, and our guides will be happy to walk you through your options to help you make the best decision for you and your family. And lastly, here is an overview of your dental plan costs. The DPPO plan is staying the same as your current plan, but you would be saving money from your paycheck if you opt for the DHMO, as that plan is costing you less in 2021 with Cigna. A few important reminders when searching for your dentist on mycigna.com or Cigna.com. For the DPPO plan, you will want to search the total Cigna DPPO network. And as I mentioned earlier, for the DHMO, you will want to search within the Cigna Dental Care Access Plus network. Dependents are covered to age 26 regardless of their student status, and your plan maximums and deductibles are based on the calendar year. Matt, I will turn it back over to you.
Susan, this slide is a reminder of how you can search for your in and out of network dental or medical providers. For those of you who are switching from the Empire Dental to Cigna Dental, like Susan mentioned, if you're looking for the PPO, choose the total Cigna DPPO network, or for the HMO, use the Cigna Dental Care Plus. This is all for you to review prior to 1/1/2021, so you can ensure that your current dentist or your possible future dentist is in network with Cigna. And I will pass it over to Jessica to discuss the ancillary lines.
Thanks, Matt. So we are pleased to continue to offer employee life insurance. This is completely paid for by the agency. It's one-time salary up to a maximum of $50,000. I just want to take a moment to remind everyone, if your beneficiary has changed over the last year, to please update as needed. In these times, we know how important it is, and we just really want to stress, if you've had any changes, to please reach out to us in HR and we can help you update them. We are also continuing to offer the Employee Supplemental Voluntary Life. We're guaranteeing employees up to $500,000. $150,000 is guaranteed, and spouses up to $150,000 with $20K guaranteed. The children benefit is up to $10,000. I just wanted to note that employee must enroll in the voluntary life in order to have their spouse or children. Next slide. We also have Cigna short-term disability. Short-term disability is 50% of base weekly income for a maximum of $170 per week. Benefits will begin after the 7th day of continuous disability for up to 26 weeks. New York State mandated paid family leave will also be eligible for those entitled employees. Next slide. Our wellness program. As in years before, we are requiring employees to have annual physicals. That is with a primary care provider between February 2020 and March 2021. These attestations can be sent into HR during that time frame, must be provided by March 31st, 2021. All non-completers will be subject to a $20 biweekly surcharge, and that will begin on April 1st, 2021. For our smoking cessation program, we are also requiring employees to complete this tobacco usage certification form. If you are a tobacco user, you will be subjected to a $20 tobacco biweekly surcharge beginning April 1st, 2021. To avoid the surcharge, employees are encouraged to enroll in the Cigna Tobacco Cessation Program, and you must participate by March 31st, 2021. Next slide. This is important contact information for you for ADP. If you have any questions on how to register, please email payroll@arcwestchester.org. We have our Cigna pre-enrollment line. As Susan mentioned earlier, if you have any questions or you need help to guide you through what's best for you and your family, please call this line. There are reps who will be able to speak with you in English or Spanish. The number here, 888-806-5042. We also have our HR and benefits website, HR Connection. You can access this through our website. Go under Join Our Staff or hrconnection.com. Our username is ArcWestchester, and you do not have to use any capitalization. Again, we just have that number for that Cigna pre-enrollment line for any other questions with medical, dental, life, and disability. Next slide. What you need to do next. So this was all great information from Matt and Susan. And now that you have a better idea of maybe what you'd like to enroll, the next thing that you need to do is if you are going to make any changes, please go to ADP Workforce. There will be a banner on your screen that will help you to go through and elect your enrollments. We also have full instructions on our announcement that was sent out on November 11th, 2020. Our deadline for self-service through ADP is December 11th, 2020. So that's a very important date to remember. If you are going to be making any changes, you'll want to do that before then. And just a reminder again, all employees are required to submit their attestations for open enrollment by December 11th. That would be the tobacco and the spouse or domestic partner verification. Your physical attestation, as in years before, your physical is due by March 31st, 2021 to avoid any surcharges. Next slide. Okay, well, I would just like to thank Tibby, Matt, and Susan. This has been wonderful information. We are really looking forward to hearing from you guys. And if you have any questions or any concerns, please feel free also to reach out to your HR manager. Thank you so much.